Hi everyone, I'm Ashley McGuire. I'm a 20-year-old senior in Jacksonville State University STEP program to obtain my Bachelor's of Science in Nursing. I'm also already a practicing registered nurse specializing in the area of cardiac. I'm only 4'10" and weigh less than 100 pounds, so you can probably all imagine the conversations I have about my weight and age that occur daily. But, as Yoda says, judge me by my size, do you? I wouldn't be so quick to. My small stature in youth has never stopped me. Have you ever just had a desire or drive to do something? That's exactly how I feel about being a nurse. I started nursing school at 17 and practicing at 19. I've learned a lot about the nursing profession, and Jacksonville's bachelor's program has only taught me to advance my role as a registered nurse. The biggest advancement I have learned and applied is effective communication and evidence-based practice. When I began, I was timid and I was shy. I just followed the older nurses' practice and didn't question it. But as I've learned more, I have opened up, I've learned to stand out, and I've learned to practice based on the evidence rather than just following. Effective communication, critical thinking, and professional behavior are all important learning outcomes in the area of nursing. Critical thinking reflects reasoning, analysis, and decision-making skills. I've applied this in my skills of medication administration, EKG interpretation, and determining patient condition. Professional behavior involves respect for all, a primary commitment to the patient, advocacy, patient safety and rights, and personal accountability for practice. I have used professional behavior when asking physicians for stronger pain medications for my patients who are hurting, informing the patients of their rights in the hospital, and taking responsibility for all of my own actions while on the floor. Effective communication reflects interpersonal communication skills. It shows your professional values and attitudes. My communication skills come out in how I approach my coworkers with an open heart and kind spirit, while enhancing their understanding of current practices. I have learned the proper method to escalate problems and different aspects of care, who to communicate with in the organization about specific issues, and how to explain new evidence-based guidelines to physicians and any other staff in a professional manner for quality assurance. I believe the greatest thing that I have come to realize through my journey is that nursing is not just a profession, but it's a whole perspective on life. I'm not solely judged by my skills or knowledge, but rather how I care for others in the same way that I would desire to be treated myself. Me, you, and anyone else in the world would rest easier at night knowing that our nurses will care for their patients like their own family instead of treating their patients like a simple task or number. You can find out more about things I have learned through my life journey in my ePortfolio, such as more about me, my philosophy of nursing, my resume, my goals and outcomes, and other learning outside the classroom and professional setting. Here's my ePortfolio where you can find a little bit more about me and my journey. More information about me is under my About page. It goes into a bit more detail about me, my family, how my journey got started, and where I am now. It also talks some about my hobbies and what I enjoy doing during my free time. You can also find my personal philosophy of nursing where I talk about my viewpoint on the profession. You can also find my professional, updated resume with my education, work experience, skills of communication, cultural competence, reliability, organizational proficiency, among others. My certifications of RN, basic life support, advanced life support, ethics, and disaster preparedness, along with my references. You can find my goals and outcomes for the future, short and long term, to obtain my CCRN certification, get my master's degree in nursing, retire before age 40, travel to 195 countries, among other goals. You'll see nursing outcomes of critical thinking, effective communication, and professional behavior, along with projects that show how I met these outcomes. You can see my coursework in education starting back from when I was a sophomore in high school all the way through my bachelor's program now. You can also discover how I learn outside of the classroom and professional setting. I learn the most from going outdoors, my family, and of course traveling. I've learned general life skills along with appreciation for nature and different cultures through my experience in 55 countries and 6 continents. If you'd like to read more about it, check out the rest of my site at girlgoingglobal.com.